So today we have with us RJ Jimmy, a voice that Bengaluru absolutely loves. And I'm sure there's no need for any introduction. People love you, they love your work. But there's one thing that not all of us or many of us knew was that you were infected with COVID-19 and you've successfully defeated the virus. Now, to
That's
begin
correct.
with, I'd like to ask, how exactly was your first reaction when you tested positive for COVID-19 and how did your life change thereafter?
Well, actually, for me, see, the thing is, because I was on air,
Mhm.
I had put many experts on air to
Right.
talk about the virus, right? So already at the point that just before the lockdown happened, I'd spoken to a
Mm.
few specialists, few experts, and I knew at that point that about 80 to 85% of the people are going to be either asymptomatic or with mild symptoms, right? So when I started getting the symptoms first,
Mm.
I was like, "ठीक है." I mean, I wasn't unduly worried. In fact, I went in for testing on the 1st of April and I posted on my social media handles, and everybody was like, "Hey, you're pulling a prank on us. This is a joke." I was
Yeah.
like, "No, are you mad? Why would I joke about this?" Uh, my results came out in about 2 or 3 days, and at some level, I knew it would be positive
Hmm.
because just a couple of days earlier, my mother had tested positive.
Yes, yes.
So, so yeah, I wasn't unduly worried. It was extremely because I was cooped up in a hospital for 16 days. My wife and daughter were in another part of the city doing institutional quarantine for 14 days. My dog was in another part of the city at a boarding because
Yeah.
nobody was at home. So it was more than anything else, I think it was just very inconvenient.
Definitely, definitely. It was inconvenient. Also, I'm sure a lot of people must have spoken to you after you recovered from the virus. So, could you tell us some of the most surprising questions that baffled you absolutely when people spoke to you about the virus?
I think one of the actually all the questions come from a place of, I think, from a place of either not having enough information or
Yeah.
from a place of fear.
Yes. Absolutely.
The one feeding the other in that sense. So I haven't really had any surprising questions, so to speak. They've all been like seemed very relevant
Hmm.
questions. One of the most, I think, one of the most often asked questions is, how did you deal with it mentally?
Yes,
Like,
I think that's really important.
because you were in isolation for so long. Uh, and fortunately, I'm very strong in the mental department, extremely strong. And also, I have a superpower. Is the superpower is that I have a very small brain, so it can only deal with one thing at a time. It can't multitask.
Right.
So that's how I dealt with it. I dealt with it one day at a time, and this is something I think that I've been able to do successfully for a very long time, is that when I'm involved in something, like right now when I'm talking to you, the only thing on my
Hmm.
mind is that I'm talking to you.
Hmm.
My mind doesn't wander off to and get distracted with other things. So I think that has stood me in really good stead through this entire thing.
Right. So that's tip number one from RJ Jimmy if we have today. Then
Yes.
I'd like to ask usually when people get admitted to government facilities, there are a lot of fears. People are scared about, say, if there are about 30 to 40 people in a single ward, then how's the hygiene maintained there? What are the protocols? And is it safe? Are the facilities enough? Most importantly, about the toilets, are there shared toilets? So, what was your experience like at the Victoria Hospital in Bangalore?
I think all of those are relevant.
Yeah.
And in fact, when I went into the ward, I had no I also had that thought. It's a government hospital.
Mm.
Uh, what's it going to be like? So and it is a general ward, So I
Yes.
I went in there, and I was surprised at how clean it was. And then as I spent more time over there, I realized that there's the nodal health officer of the trauma care center at Victoria Hospital called Dr. Asima Banu. She and Dr. Balaji Pai were in charge of that particular wing.
Okay.
And I think they were just fabulous. So, constant communication with everybody. People who came into the ward were put on a WhatsApp group. And she tried to ensure that we were as comfortable as possible. She treated us like family. The wards were spick and span. They were cleaned thrice a day. Okay.
Right.
The toilets were shared, but I guess that's a situation in any general ward. And
Yes, that's true.
so I guess it at some level it was up to each person to ensure that the toilet was kept as clean as possible and try not to catch another infection from there. So, I mean, in terms of the staff and all of that, they were brilliant. I think they were fabulous. They did a fabulous job over there. And I think, and one of the things that I have spoken about quite highly is about how they dealt with us. For example, Asima Banu, there were kids who were coming in there without their parents, like a 6-year-old, 10-year-old,
Right.
because they had tested positive. And Dr. Asima ensured that there was a projector that was sent there with a laptop so they could watch movies.
That's wonderful.
She conducted painting competitions for them, announced winners through the
Right.
WhatsApp group. She at that time TikTok was still available to us,
Yes.
so she was making them do
Hmm.
TikTok videos. So I think that the healthcare staff there have been, and this was early on. This was in
Yes.
April, and at that time there was so much uncertainty about the virus. At least now there are some more protocols in place. At that time there was so much uncertainty, and in spite of that uncertainty, they dealt with us with so much love and empathy. It was amazing.
Absolutely. And also, I think a lot of us don't understand this, that it's not just the patients who are going through this for the first time, it's also the health workers, because this is still
Yes,
something new, something evolving, something we don't know much about. And the health workers are definitely going out of their way, as you mentioned, at the Victoria Hospital in
yes.
Bangalore, and they're
And
helping.
sorry, just to add to that, this was in April. Okay, it was summer,
Yes.
right? And they were in PPEs for six
Oh, yes,
hours with
absolutely.
masks. They were sweating inside, and the protocol was that once they don it, which is they wear it, they have to wear it for 6 hours. So for
Yes.
6 hours, they don't drink water, they don't eat anything, they don't go to the loo. They have to be in their PPEs, and yet they were smiling all the time. So it was just like fabulous.
Wonderful, absolutely. Also, there are a lot of social stigma, I'd say, and discrimination
Yeah.
around those who've been infected with COVID-19. Like I've been reporting all day, I come across stories where people don't want to conduct their own relatives, deceased relatives, last rites or their funerals because of this. How do you think can we get rid of this social stigma?
See, I think that one of the things that has led to this kind of treatment
Hmm.
of people uh, is the way media has handled it. There's been so much focus on reporting casualties, reporting mortality, reporting. I mean, the entire environment in which it was reported was in an environment of fear.
Yeah.
So that was one. The second was, I think that the local officials, the local authorities, in their zeal to keep the virus under control, went a little overboard in the way they dealt with people who had been infected,
Hmm.
and containing zones that had infected people.
Right.
That was one part of it.
Right.
uh, I think, however, and this is, I was invited by the government of Karnataka for a panel discussion to talk about how can we destigmatize
Hmm.
COVID.
Hmm.
And my suggestion actually was actually trying to hit two birds with one stone. I said, listen, you're creating a containment zone when someone is infected, right?
Hmm.
The BBMP is going out there and creating a containment zone.
Yes.
When the person comes back after they have recovered from the virus, do a celebration for them. And the
Right.
reason I'm saying do a celebration is that these people who have recovered from the virus and have come back are actually some sort of superheroes, not because they fought the virus, but because their plasma now has antibodies. And
Yes.
these antibodies can be used to treat critically ill patients, which means
Yes.
that you can save a life, right? So the fact that someone has recovered and come back and they have the ability to now save a life should be celebrated. And if you do that, I think that when people see that celebration happening, when they realize what the actual truth is, I think that will help destigmatize a bit. I mean, that was my idea.
Wonderful. Absolutely, absolutely. Talking about saving a life, did you decide to donate plasma and
Yeah,
take care?
yeah, I did.
Yeah.
I've in fact
How
donated
was that
twice.
like?
Uh, it was very simple, yeah, very peaceful. It didn't take more than an hour.
Okay.
You just lie down, and I learned something also, which was great. They extract only the plasma, and they return the other blood components to the body.
Okay.
And when they do that, there's a little pain when the blood is
Hmm.
being returned into the
Hmm.
body. And I was like, why is the pain? So the doctor explained to me, see, the blood that has come out of your body is now at room temperature, whereas the blood inside your body is slightly warmer. So the
Yes.
blood that's entering your system back is slightly colder, and that's why you feel the pain. And I was like, whoa, I did not know that. So yeah, that was quite cool.
Yeah.
So it's a very simple process. In fact, it doesn't take more than an hour, and you can donate every 14 days. And I think with every pack of plasma that you donate, two lives can be saved. So I've been trying to push people to go and donate plasma. I did this campaign on air. In fact, my producer, who helps me brainstorm for the show, came
Yeah.
up with the idea of मेरे पास बंगला है, पास ये है, वो है, मेरे पास माँ भी है, तुम्हारे पास क्या है? And the line was, मेरे पास प्लाज्मा है.
Plasma. Yeah.
So yeah.
Wonderful. Right. So I'd also like to ask, while fighting the virus, it's really important, as you mentioned earlier, it's really important to keep your morale high. How did you do
Mhm.
that when you were infected? And how did you see people around you kept their morale high and remain motivated?
Well, I think that the thing is that it was quite early days at that time.
Mm.
This was April, and like I said, I'm very strong in the mental area, and I take one day at a time. I mean, it's the only day that I have control over, and I think that's how I kept myself. I kept myself motivated. What I did was I had markers for my day,
Okay.
and the markers were basically food markers. So there'd be breakfast at 8 a.m. There'd be a snack at 11. There'd be lunch at 1, another snack at 4, and dinner at 8. And
Right.
those were the markers for the day. And then in between that, you tried to fill up time. So I read a lot, and my mother was in the ICU during that time, so I
Mm.
was doing some healing for her from the hospital, pranic healing. I'd spend some time on that. I did some deep breathing exercises, because my theory was that I mean, deep breathing obviously helps with the immunity, but my theory was that the virus has gotten into your system and doesn't know how to get out, so you have to show it the way out with deep breathing. Say,
Right.
yahan se jana hai aapko.
Right. Absolutely. So, what are your tips for those who are scared right now? Because the numbers are rising, there are a lot of cases, a lot of people are getting infected each day, and people are scared about the virus. So, what are your tips for all those who are scared out there?
See, the numbers are going to rise. 80 to 85% of the world is going to get infected. Okay, you're lucky if you're part of the 15% that doesn't get infected,
Right.
right? The trick is to keep the mortality low. Right now, I think governments are managing to do that. Our recovery rate currently in the country is at about 73%, which is
Hmm.
far higher than some of the other countries.
True. Yeah.
So in that sense, I think we have to be careful about. I think the word is to be cautious and not to panic, right?
Yes.
Only 1% or 2% of people go into critical care. If you have comorbidities, you have to be extra careful,
Yes.
because when you have comorbidities, it's a little more serious. But otherwise, just follow the rules that everybody has laid down. And I think this has now become part of everybody's lingo, which is SMS, which is social distancing, masking, and sanitizing.
Yes.
So
Absolutely.
if you're able to keep the SMS lingo in place, uh, be cautious, but don't panic. Look at the fact that there are so many recoveries. uh, you know uh, if you look at the number of people who have died at currently, it's not even 1% of the number of people who have died due to smoking. you
Yes.
know
Yeah.
so look, if you look at it like that, uh, it, it, it is frightful in that you don't know how you're going to get it. But also, I think that at this point, the healthcare workers have a better idea of how to deal with it. And so because of how much time has passed,
Yeah.
so yeah, there really is nothing to fear. Most people will be asymptomatic or mildly symptomatic.
Wonderful.
So
Thank
don't
you.
panic, because when you panic, it lowers your immunity.
Yes.
So smile, smile.
So that's the idea. I hope everybody is going to follow this, that you're not supposed to panic and
Yes,
be cautious. And I'd like to thank you for speaking to me and,
not at all.
simplifying the entire process. Now, if anybody is infected, I'm sure looking at this interview, they will not panic, and they'll definitely be a little more calm and composed and just recover as soon
Awesome.
as possible.
I just want to add one more
Yes.
thing before I
Yes.
sign off, is that for people who have recovered
Hmm.
and who are watching this interview, please go and donate plasma. It
Yes.
will help
Yes.
save a life. And the
Definitely.
website to go to is covidindiacampaign.org.
Yes. What better than saving a life? Definitely. Thank you. Thank you so much for speaking to me.
Pleasure.
Take care. Thank you.
You too. Cheers. Bye.